Hello, everyone. My name is Raul Melendez, and this is MPA 570 Policy Issue Analysis for Public Administration. This presentation provides a policy analysis of mental health crisis calls and law enforcement response in California using 2020 as a baseline year and comparing it to conditions in 2025 following the implementation of several federal and state policies and identifying the key organizational stakeholders affected by these policies. Furthermore, the analysis will focus on the high volume of mental health crisis incidents and the continued involvement of law enforcement as responders to non criminal behavioral health emergencies. For the problem analysis scope and demand, in 2020, prior to the implementation of the 988 Suicide and Crisis Lifeline, California accounted for approximately one out of every eight calls to the National Suicide Prevention Lifeline, indicating a high baseline demand for crisis services. Following the state-wide launch of 988 in July 2022, crisis contacts increased significantly. For example, California recorded over 380,000 crisis contacts in the first year, over 420,000 contacts in the second year, and over 430,000 contacts in the third year. Between July and October of 2025, nearly 165 crisis calls were answered nationwide. These figures show consistent ongoing demand for crisis response services throughout California. So, problem analysis, demographic patterns, and statistics in California. Upon researching California Health and Human Services Agency, the AB 988 chart book, demand and utilization data, 911 and 988 call volume, and this disposition data. Here, focusing under the lower section, 911 data and behavioral health emergencies. Studies estimated that 5% to 15% of all calls to 911 are for behavioral health emergencies. A Vera Institute analysis of 911 call data in 9 cities estimated that an average of 90% of calls could be answered by unarmed crisis responders. For illustration purposes, only using the 5% of 15 estimates or 15% estimates as a rough proxy for behavioral health would equate to between 1.35 million and 4 million behavioral health related calls being answered by 911 in California. If 10% of the behavioral health related calls to 911 were transferred to 988, that would be an additional 135,000 to or through 400,000 calls annually, an increase of between 35% through 96% of current volume. Uh, in demographic patterns and statistics in California continued under the California Health and Human Services Agency. Some of the key takeaways here is death by suicide. Almost 50,000 people died by suicide in the United States in 2022. 4,312 of those were in California. Across the state, suicide rates vary widely in rural and remote areas, experiencing higher rates both in California and nationally. Based on average population rates, the highest risk of suicide was among males aged 85 years and older. In 2020, suicide deaths among veterans aged 18 and over or age 18 over accounted for 15% of all suicides in California. In 2021, American Indian, Alaska Native, and white Californians had the highest rate of suicide in California. In 2022, um, American Indian, Alaska Native had the third highest rate of suicide in California after white and Pacific Islanders in California. So here, continued demographic patterns and statistics in California. Disparities in suicide by age, burden of youth and older adults. United States adults aged 35 and 64 years account for 46.8 of all suicides in the United States, and suicide is the eighth leading cause of death for this age group. Youth and young adults ages 10 through 24 years account for 15 of all suicides, 11.0 per 100,000. Although youth dies by suicide at a lower rate than other age groups, suicide is the second leading cause of death and increased by 52.2% between 2000 and 2021. Adults ages 75 and older have one of the highest suicide rates, 20.3 per 100,000. Men ages 75 plus have the highest rate, 42.2 per 100,000, compared with other ages or other age groups. So suicide counts burden by age group 2021. Here we can see ages 0 accounted for 5 through ages 5 through 9, 10 to 14, 45, 15 through 19 ages, 167, 2024 through 338, 25 through 44, counting for the highest, 1,474, 45 year old through 64, 1,218, ages 65 through 84, 757, and 85 plus 147. Therefore, just highlighting who is affected by uh, this social issue. It'll be youth and adult or adults. In regards to current policy or laws pertaining to this social issue, the first one being presented in my presentation is the CARE Act, which was enacted through Senate Bill 1338. The law took effect on January 1st, 2023, and the CARE Act establishes court ordered treatment pathways for individuals with severe mental illness. Current policy crisis interventions team in California, being the second current policy presented in this presentation. The Crisis Interventions Team program trains law enforcement officers to respond safely to behavioral health crisis. This model focuses on de-escalation and crisis stabilization during police encounters. The next one being 988 Mental Health Crisis Line, which was launched in 2022. The 988 system connects individuals in crisis with trained crisis counselors. This policy was established through the National Suicide Hotline Designation Act of 2020 and was signed on October 17, 2020. The goal is to reduce unnecessary police involvement and emergency department use. Stakeholders impacted by these policies consist of behavioral health, public safety, and advocacy organizations. For example, the 988 Crisis Call Center and behavioral health nonprofits responsible for crisis intake, triage, and referral services under the federal and state 988 implementation guide or guidance. Riverside County Behavioral Health Department, designated by California Department of Healthcare Services to implement CARE Act requirements and coordinate local crisis response team or systems. Local, county, and state law enforcement agencies impacted by statewide crisis response training standards and response expectations. And mental health advocacy organizations such as Take My Hand, which monitor CARE Act implementation and 988 systems performance through public guidance and reporting requirements. And for closing statements, this policy analysis examined mental health crisis response in California using 2020 as a baseline year and crisis service utilization data through 2025. The analysis identified continued demand for behavioral health crisis services and ongoing interaction between crisis response systems and law enforcement. The existing federal, state, and local policies include the CARE Act Crisis Intervention Team and the 988 Mental Health Crisis Line, which address different components of crisis response and are implemented by multiple public agencies and non-for-profit organizations. This concludes my policy analysis presentation. Thank you so much for watching this presentation.